Hello, I am Hidelbrando Mota Filho, urologist from Fortaleza, Ceará, and we are today in the conference of Brazilian Society of Urology in Salvador, Bahia, and we have the pleasure to be with one legend of urology, Dr. Laurence Klotz, the professor of urology of Sunnybrook. And we are here to talk about some highlights of the Brazilian conference. And we have some highlights about the imaging regarding the diagnosis and treatment of prostate cancer. So I would like to ask you, Dr. Klotz, what is your thoughts about the micro ultrasound? You did a lecture about that new technology, and you give some very good news to the urologists.
Yeah, well, I think it's a terrific technology. The advance is that it's 29 megahertz instead of 6 to 9 megahertz. The resolution is 70 microns, which is the diameter of a prostatic duct. So it reveals changes in ductal anatomy, which is the same principle as diffusion weighted imaging for MRI. And it means you can see cancers that you cannot see with conventional ultrasound. It's quite easy to acquire the skill to recognize these cancers. And there's now about 15 studies in the literature, all of which show that the sensitivity for detecting cancer of micro ultrasound is about the same as MRI. Some studies have shown it's even better. The specificity seems to be comparable. The advantage is it's a lot less expensive than MRI. In theory, it could be much more widely available because essentially it's an ultrasound. It's imaging that's done by urologists. And it also means it's a single stop for the diagnosis. So instead of the patient having to have the MRI and then have the co-registration and then the fusion biopsy, he just comes in, you do the ultrasound. If you see there's an abnormality, you inject some xylocaine, some anesthetic, and do the biopsy. The whole thing is very quick. And from a patient's point of view, it's very appealing. There's other advantages over MRI. It doesn't require contrast administration. There's no issues of having implanted devices, claustrophobia, and so on. I don't think it's going to replace MRI. It's complementary. There are cases where you see a lesion on ultrasound that you don't see on MRI, and vice versa. Overall, it's around 10 or 20% of cases will only be visible on one of those modalities. So in my practice, I now usually use ultrasound as the initial imaging technique in patients with an elevated PSA rather than MRI. Saves a lot of MRIs. And in patients on active surveillance, I alternate. So every few years, I do micro ultrasound. 2 years later, do MRI. I think together they are a more powerful way to follow the patient than using either one alone.
That's very impressive because that's a technology in the hands of the urologist. So that's make the difference. Put the urologist again to lead.
The one who is
Uh,
doing the imaging of the prostate.
yes,
Yeah.
and also it's very specific and sensitivity to reach and to identify the suspicion lesion. And what about the biopsy? It's possible to do the biopsy with that technique
Yes.
also.
Oh, yeah. That's what I'm saying. Absolutely. And I do transperineal biopsy. There are several techniques for doing this. There's a clip that attaches to the transrectal ultrasound device that allows you to guide the needle very precisely. And there's no guesswork because you see the lesion, you see the needle going into the lesion. You
Okay.
don't have to rely on the radiologist accurately doing the co-registration, and you hope the fusion targeting works out. You hope the patient hasn't moved. There's a lot of potential sources for error with the MRI plus fusion targeting technique. It works, but this also works very well. It's simpler, and so it's very appealing, I think, for urologists who are in the business of doing biopsies to adopt this.
In other words, we have a new modality of biopsy because we have a real-time biopsy. That means that we see what exactly
That's
we
right.
going to biopsy. So
That's right.
we see the lesion very clear on the micro ultrasound, and we see the needle
Mm-hmm.
pass through the lesion. So that's make the difference, and we know for sure that we're gonna take the exactly place.
Yeah,
Yeah, that's
and the device also has a fusion targeting
okay.
capability, so you can show a picture of the MRI with the lesion outlined if you and superimpose that, but usually you don't need that because you can actually see the lesion on the ultrasound that corresponds to what you see in the MRI.
Perfect, perfect. We have a good news because we have that machine in Brazil. The first place is in our town in Fortaleza. So we just start to use that technology, and we hope that we're gonna help a lot of patients with that technology.
The only other thing I'll add is we're now doing a large trial in over 1,000 patients comparing MRI to microultrasound to the combination for patients who are having a biopsy. And that trial is accruing very well. So I think within probably 2 years, we should have solid level 1 evidence that it is more or less equivalent to MRI in terms of the diagnostic pathway.
Well, thank you very much, Dr. Klotz.
Pleasure.
We appreciate. See you.
Thank you. It's great to be back in Brazil.
Nice.